Let's now look at the treatment.
Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, lean them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts. And if after 3 cycles the obstruction is not cleared, you should then call 999. If at any time the casualty becomes unresponsive and unconscious, you should support the casualty to the floor, call the emergency services as soon as possible, and commence basic life support. With a choking baby, you should hold the baby in a similar position as a recovery position by supporting the baby with their head pointing downwards. As with an adult or child, you should first attempt 5 back blows. If this is not successful, turn the baby over and attempt 5 chest thrusts. If this is also unsuccessful, you should repeat the cycle of 5 back blows and 5 chest thrusts. And once again, if the object or obstruction has not become clear after 3 cycles, then call the emergency services.
Mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk /donate.